Hi, my name is Dr. John Heary. Today I'm going to be talking about exclusively about type 2 diabetes, prediabetes, and blood sugar dysregulation. I'm going to show you the roadmap that I've been using with patients for the last 24 years. Now, before I get into that, I want to give you a little information about me and why you should listen to me. Like I just mentioned, I've been helping patients with blood sugar issues. It's been about 24 years now. And I'm certified in functional medicine, and I'm also a certified clinician in whole food nutrition. Now, when I say functional medicine, I don't want you to think, oh my gosh, he's going to give me, more medicine. No, I take a functional approach. What that means is that I dig, I find, and I work towards fixing the problem, solving the puzzle, not just more chemical cover-ups. That's the failed medical model where you go in, you have XYZ symptoms, and here's XYZ medication to cover up the symptoms, ignoring the underlying root cause of why it's there to begin with. I use the analogy a lot of, if I'm driving in my car, the check engine light comes on. Do I slap a piece of tape over it, hoping it goes away? Or, do I pay a mechanic to look underneath the hood and fix the thing, solve the problem, fix it, so I can take the Band-Aid off. Medications are chemical cover-ups. They're Band-Aids. We can do better. We have to do better. That's what we do as functional medicine doctors. What we do is safe, it's natural, it's highly effective, and it works. Thousands of transformations over the past 24 years. There's about 38 million Americans that have type 2 diabetes. 38 million. That's 1 in 10 people, you guys. 1 in 10 people, full-blown type 2. It's a big problem for a lot of people. Let's say you're walking through the mall. You get 10 people there. One of them has full-blown type 2. With that, as you probably know, comes consequences. Your eyes go bad, potential blindness. Your kidneys go bad, dialysis. Diabetes is the number one cause for people ending up on dialysis. Maybe you have neuropathy, numbness, tingling, pins and needles, burning, sharp stabbing nerve pain. Neuropathy is awful. You get a cognitive decline, brain fog. In fact, Alzheimer's disease has been coined type 3 diabetes because high insulin levels and high blood sugar levels are toxic to the brain. Another common complication is cardiovascular disease. The number one cause of death for a diabetic is a heart attack. This hits close to home for me. This is also why it's so important for me to get this information out to as many people as possible. My mom, she died from the cardiovascular complications of type 2 diabetes. She developed an open wound on her foot that wouldn't heal. She went to the hospital and they ran all kinds of tests on her, and they found out that all the arteries to the heart were 95% blocked. The cardiovascular surgeon, he wouldn't even do surgery because he didn't think that she would even make it off the table. They tried to do like a roto-rooter procedure down her leg to increase blood flow to her foot, and they only made it about halfway down her leg, and they had to stop because the artery in her leg was so hardened from the diabetes and from the insulin resistance. Unfortunately, she passed away about 2 weeks later in the hospital. There's a whole list of things and consequences that happen, if this thing doesn't get reversed and solved. Now, if your doctor said it's not reversible, it's not treatable, take this, it's time to punt. It's time to go for a second opinion. Time for a fresh outlook because it is reversible. It's fixable. It is solvable. If you have the right roadmap, if you have the blueprint, again, another analogy, if I'm trying to go from California to New York and I don't have a map, how successful, am I going to be? I'd be lost, right? I'd be frustrated. I'd be confused. But if I had a straight line, a path to do this, eat this, don't eat that, let's do this test. If I had that, straight in the line, straight line of path, I'm going to do much better. And we have that. All right. So, pre-diabetes. Here's another scary thing. There's 88 million Americans that have prediabetes. That's 1 in 3 people. 1 in 3 people have prediabetes. Here's the scary part. Even more scarier, 84% they don't even know they have it. 1 in 3 people, 1 in 3 have full blown prediabetes. 84% don't even know, right? And that's a scary thing. Which means within 5 years, if they don't get off this roller coaster of the standard American diet, spiking your insulin with every single meal and snack and snacking all the time, if they don't get off this roller coaster, they're going to end up with full blown type 2 diabetes. Just a quick tangent on the standard American diet. As it's called the SAD diet. It's very processed, it's very pro-inflammatory, and it's very toxic. There's too much sugar. There's too many things that turn into sugar. And I think it's about 100 years ago, the average American consumed about 3 pounds of sugar per year, right? 3 pounds. It was a delicacy. It was very expensive. Now it's upwards of about 140 pounds of sugar per year. It's in everything. It's everywhere. And they changed the name of it. So it starts off as sugar, then let's change it to, high fructose corn syrup, right? Because it's sweeter, it's cheaper, it's more addictive. High fructose corn syrup, that wrecks your liver, so, let's call it corn syrup. Now, let's keep on changing the name. And, I think there's upwards of something like, 70-ish different names, for naming sugar. They start calling it different things. So, when you're looking at labels, maltodextrose, start looking at, tapioca starch. There are super sugars that stick in these processed foods, and they're built by chemists. And sugar is very, very addictive. 93% of rats, they did this study, 93% of rats prefer sugar over cocaine. Now, I want to say it once again. You might want to write that one down. One of my mentors taught me this a long time ago. 93% of rats, they prefer sugar over cocaine. It's that addictive, and they put it in everything. It's everywhere. You can't even avoid it. You got to watch your labels, but you got to watch the hidden sugar names. There's over 70 different names. They call it different things. If you want to, get things fixed, you have to pay attention right here. Right now, in order to truly get well, you have to fix the cell. All right, you have to fix things at the cellular level. Why? Your cells make up your tissues make up your organs, and your organs make up your organ systems. If your cells are sick, right? If they're inflamed, if the receptors are blunted, which I'll talk about in a second, you're building yourself sick, and we have to fix this. I have to take you, back to cell biology. I have to get just a little sciencey on you, and I apologize. I'll go slow because some of this might be a little bit confusing. So definitely I'll slow down just a tad. A healthy cell, they have these little finger-like projections coming off of them. They're called receptors. All right, it's how your cells communicate. It's how hormones get into the cell. They do their work, and they do what they're supposed to do. Now, a healthy cell, it has a lot of these finger-like projections. It has a lot of receptors. Now, within the cells, we want waste products to come out of the cell, but we want the good stuff to go into the cells. There has to be this flow. The cells, they become dysfunctional if they don't have this flow. So, what happens is when we get, dysfunctional, we become inflamed. The cells become inflamed. You know what inflammation is. There's a lot of drivers of it. Sugar being one of them. Sugars, toxins, bad fats. And I can go on and on. With stress, with dehydration, hidden infections, food sensitivities. There's a lot of drivers of inflammation. Systemic inflammation causes cellular dysfunction. It can blunt the receptors. When the receptors are blunted, the cells become dysfunctional. This can lead to insulin resistance. When you become insulin resistant, you cannot get sugar into the cell. So the sugar builds up in the blood, right? And that causes high blood sugar, right? That's your type 2 diabetes. We have to get sugar into the cell. That's how your cells produce energy. So in order to truly get well, if you want to reverse this thing, if you want to solve this puzzle, we have to fix things at the cellular level. We have specific protocols, clinical frameworks and testing that we do that fixes the cell. So again, we have to make sure that we fix this thing at the cellular level. If you go the medical route, what do they do for you? Typically, they'll start you on metformin, right? For the blood sugar, that's going to help lower the blood sugar down, and then they'll give you a statin drug for cholesterol, and they'll probably give you a high blood pressure medication as well. And this is going to work temporarily, but over time, as the diabetes progressively gets worse, your dose and number of medications will increase until eventually you're going to end up on insulin. Now, what they don't tell you is that insulin's a fat storing hormone. So the more medication and insulin that you take will cause you to become more insulin resistant, and it's going to cause you to gain more weight. It's a vicious cycle. So you can go the medical route. You can keep on taking more and more medications. It's not the problem. All right, it's not going to fix the problem. The problem is that we have to fix things at the cellular level. Now, the good news is that your body is a self-healing, self-regulating organism. We can push things in the right direction. We can, push you this way if you have the right math, if you have the right blueprint, the right framework, and we do have that. The question is, do you want it? By now you're thinking, okay, what's the next step? I need help. I want a fresh approach. I want a fresh outlook. I want to work with somebody one-on-one who can help me fix this thing and help me get off the standard American diet roller coaster, spikes and dips and crashes. The standard American diet, looks like this, right? Pizza, spaghetti, lasagna, tacos, hamburgers, hot dogs. This kind of stuff, it's carb heavy. Carbohydrate is sugar in disguise, and you probably know this. We want to stabilize blood sugar. But for example, when you have, and I'll give you an example here. If you have, Subway for lunch, and people think, Subway's healthy, but that, spikes your blood sugar, and then you get a crash. Crashes lead to cravings. Cravings, cravings again because you're crashing, because you get this massive insulin surge, then you crash, and cravings, because now you're crashed. Now you're craving certain things like sugar, coffee, carbs, something to get you out of this crash. I also want to touch on cortisol. Cortisol is a hormone that's produced by your adrenal glands. It has a direct correlation with insulin. I've never seen a type 2 diabetic that's had normal cortisol levels. Cortisol runs on a circadian rhythm. So, it should be, highest in the morning, and it should come down as the day progresses. It should be lowest in the evening. If cortisol levels are high, it can lead to weight gain in the midsection area. And it doesn't matter how much you exercise or how low you cut your calories. It's going to be nearly impossible if you lose that belly fat until we get the adrenals working properly. So it's important for us, to get comprehensive blood work and saliva tests to find out the underlying root causes of your blood sugar dysregulation. Once we find this out, then we can put a personalized plan together, for you to start regaining your health. If you want help, if you want to find out if I can help you, then the next step is to schedule a discovery call. This is simply a chance to ask each other questions. I'm going to ask you questions, and you're going to ask me questions. We're going to have a quick conversation, probably, about 15 minutes or so, and, I'll explain the process to you. And if you need help and you want to work together, we'll set up a consultation where I can go through your complete case history and really get a complete understanding of what you've been going through up to this point and find out if you're a good clinical candidate. There's absolutely no pressure on the discovery call. It's simply a chance to connect and see if what we have would make sense for you. The question at this point, really, you have two options. You can do nothing, and that is totally an option, or you can schedule a call, and we can have a chat, and I can show you, hey, this is what I've been doing for the past 24 years to help sick folks get well. Help repair cells, broken cells, reduce inflammation. Take pressure, off the gut. And my framework as functional practitioner is to look at things from a holistic perspective, from a global perspective. My job is to find the root causes of your illness. I have to look at foods, nutrients, toxins, bad fats, sugars, hidden sugars, hormones, cell health, cell inflammation, gut health. We have to look at the sum of the parts, not just, take this insulin, come back in 6 weeks, and we'll check you again. That's why we have 38 million Americans, that have type 2 diabetes, and another 88 million that have pre-diabetes. If the medications work, we wouldn't have such an issue. We wouldn't have dialysis machines. We wouldn't have, strip malls full of dialysis businesses all over the place. We can do this. We just have to, make smarter choices. We have to have the right map. We have to have the right blueprint. And, if you want it, let's chat. Your next step is to click on the calendar link, grab a time slot that fits your schedule, and we'll talk soon. All right, take care.